what should I be doing with my physical therapist? What should I be doing like after today to take care of it?
Well, with labral tears, it won't heal. That labral tear will be there. I mean, you can, have it operated on. Obviously, that's what you don't want to have at first. And your rotator cuff is probably compromised as well. Getting your shoulder in shape is going to take some, it's going to be a process. It's not an overnight thing. It's going to take some flexibility, which I'm sure your physical therapist is doing. Stretching to make that happen. Strengthening, tubing exercises.
What's tubing?
Tubing exercise. Tubing bands and stuff like that. And the physical therapist is pretty basic stuff to show you to get your shoulder in better shape. Because what happens is that on the inside lining where that labrum is, what happens is everything around it starts getting bad. When you don't move your shoulder, everything starts going bad. The muscles become weaker, and there's less elasticity and stuff like that. So these things have a tendency to get worse by just sitting around, you not moving your shoulder. So with you moving your shoulder right now and getting in those range of motion, a lot of guys who pitch in the big leagues with labral tears, it depends on how severe it is and what their motion's like. Sometimes they change their motion and stuff like that. So, I think you're on the right track. I think you're on the right track with a nutritionist, physical therapist, getting your flexibility back, and making a commitment to yourself.
Without getting surgery, what kind of velocity is he looking at as far as pitching goes? You said there are guys in the big leagues who are pitching with labral tears.
There are guys who have labral tears, and a lot of these guys, some of them don't even know they have labral tears. It just goes along the territory. Will you be able to throw as hard as you did before? Probably not without surgery, but are you going to be able to bounce back and throw? There's probably a good possibility that you can with the proper, mechanics, help, and getting your body back in shape. Yeah.
And typically, in the week that guys are here, guys similar to me that might not have thrown or and look, I'm taking a year and I'm going to be throwing coming to here. There are guys that just roll out of bed and show up here. What are some of the things you see as far as
some of these guys haven't picked up a ball in 10, 12, 15, 20, 25, 30 years for some of them. And I worry about other things before I worry about their shoulders. Kind of worry about their overall physical health of a guy who's in his 60s and hasn't been sedentary for a long time, and now he's running around outside, running down to first base and maybe not proper shape. Low back problems, heart problems, you're looking at things that are a little bit bigger than the shoulder. So basically when they come in here, I really like to get in the whirlpool, get them in here, assess what they're doing, tell them take it easy the first day, become acclimated to the weather, which is actually not that bad. Usually it's a lot warmer than this, which helps us actually. Making sure they're properly hydrated, make sure they have enough coverage outside in case something does happen. And in fact, the matter is, defibrillators, making sure the trainers are watching the fields. People who have diabetes and other problems, we need to know about that early. Allergies to bugs, bees, the whole realm comes in. I think of all the major stuff first, and then worry about the rolled ankle, because we can, give you some over-the-counter stuff, some ice, tape you up, and get you back out there, because they're sub-max. These guys are going sub-max out here. These guys are not going down first base and fourth to it. So, they're most of the times, and we've been pretty lucky actually over the course of the years. We've only had a couple. Eddie Moore, hurt his knee, and a couple other guys have had a couple of things here and there. But for the most part, looking at the health of most of these guys and what they're doing out there, it's pretty remarkable. They haven't had any more injuries than we had.
Without surgery, I mean, Mark's messing around with medicine balls. He's obviously trying to do all this stuff with trainers, with flexibility, with muscle building. What's the likelihood, I guess, of exacerbating this injury? Is this something that can get worse easily?
Yeah, actually, it can get worse. The labor could tear even more, and you could get to the point where you just can't move it anymore because it comes around, and usually labor, the guy will move his arm and then get to a spot, can't, then he gets past it and it's okay. You're probably going to be able to throw 85%, probably. It's kind of a tough guess because I don't know how bad it's thrown. I haven't seen the films. Yeah, exactly. And you can rehab to the point where you can play recreationally and get through with it, and have fun.
And what are some of the other things like to be able to stay away from those issues? Like for the year, I had my hip operated last April, replaced, and since that point, before that, it deteriorated to the point where I stopped playing hockey, I stopped doing a lot of things I used to do.
Right.
So, and put on a lot of weight. So what are some of the things I need to do over the course of the year to be ready to do stuff?
It's going to be a total transformation. It's going to be your shoulder, not be back. You make sure your low back is stretched out. You drop weight. Your health is the most important thing. But before baseball, your health is the most important thing. Making sure that you take care of yourself and your blood pressure's down and you get clearance and your heart's fine and you stress, whatever you need to do as far as getting the physical is concerned, and all your blood work comes back fine, and you look like you're taking this pretty serious and taking care of yourself, which is really the most important thing. All those things will come together as you feel better and better and better, and as you're able to go outside and do some cardiovascular running, maybe 3 times a week, 85% of your VO2 max. It's kind of I can explain to you later, but going out for a walk every day, being active, taking it nice and easy when you're throwing, doing your weightlifting, dropping some weight, and make sure you get to the doctor every couple of months and for a checkup and make sure you're doing well, and everything will come together.
Over the course of these so many years you've been doing it, you've seen different stories. Like we ran into a guy who lost 67 pounds since May to get down here. Have you seen a lot of that, like people using this as motivation to get in shape?
I've seen a couple of guys come down here and they didn't fare too well and they had to sit out a game or two and they weren't really happy about it because their competitive spirit brings them down here. And the next year they came back, and for the most part, I wouldn't say it was a 67-pound transformation, most of the guys, but you can see some of these guys have lost 8, 10, 12, 15 pounds from the previous year, and maybe they just did it in the last month or so because they want to get ready. Maybe they did it over the whole course thing, and it's a good lifestyle change. It's a nice idea. When this guy says this and sticks to it for the whole year, it's really pretty remarkable.
I mean, the heart, health in general, the hip, the knees, all of that, obviously weight loss is going to help it. Is weight loss going to really affect the shoulder?
No. I don't think that. I think your mechanics of your shoulder are the mechanics of your shoulder. Right. It's just that when you go outside and you're 25 pounds less, right, you pick up a 25-pound weight and run around with that all day. It's just to see how much more your heart has to work for this.
Right.
And so much easier it is when you get all that weight off, you just feel better, and you're able to be more athletic and doing different things, and you just feel better, basically, right, than that. But it won't affect the shoulder as far as the weight's concerned, but you'll feel better overall.
And once I start a throwing program with my pitching coach, when I get home and I'm not going to the physical therapist, ice, heat, what like right now even, like
generally,
it's like
right, it's
barking.
Sure, it's a struggle. Basically, what we do here is bring people in and then we heat them up early. We use ultrasound, the heat, and we loosen everything up and we stretch and make sure you're nice and ready to go outside. After you're done throwing, in your case, I would definitely ice. Put the stim machine on there that pumps some muscle in there, pumps some blood out there, and make sure we get the ice to get rid of the inflammation. An anti-inflammatory medication over the counter is usually where we start at, something where, ibuprofen, leaves, something like that to start you off with. And then if it doesn't nip in the bud, we start going to other things, and the doctor will look at you and prescribe maybe, prescription medication to get, some of the inflammation down. And then we usually, at the end of the day, we'll ice you. We never really, very rarely will we ice them in the morning. Sometimes when you get a guy in rehab who's not yet throwing, sometimes we'll do some contrast, which is heat and ice. We'll go 5 minutes of heat, 5 minutes ice, and try to bring that blood in and out, to kind of move things around a little bit and decrease the inflammation to get some movement in there. So basically, it's you warming up early and then using the ice and stuff.
So like obviously, when I go to the physical therapist, we do all the work. He does it a wrap in a different way.
Right.
I come home from throwing. What's the best way for me to apply ice in the right area?
And I get this question a lot, and I got people who have vasectomies actually ask me a question with this, and it ties in. I know it's kind of a strange thing to say. A frozen bag of peas is the best thing to use. And I'll tell you why, it conforms to the area. You get a big bag of frozen peas, and I'll take that bag of frozen peas and put it on top of your shoulder and then wrap it around here. The peas will conform to the area of the shoulder.
Just like you put it
instead
on
of getting
with a towel?
Right,
like
yeah, or you can take it and put it inside the towel in here, put it on top here, and then wrap it around so that it doesn't slip off the plastic. It keeps it on here, and what happens is, this keeps it, and people who have vasectomy, instead of having to go get big chunks of ice and put it on an area that has to conform, the bag of peas conforms around that area really, really good, and then you don't have to worry about the bag leaking. You don't have to worry about filling it up, going to get ice, getting the bags, wrap it on. You throw it right back in the freezer, and in 20 minutes, it's ready to go again. So it's actually a pretty decent thing. You don't have to spend a lot of money on bags and ice and this and that. Get a frozen bag of peas, and then at the end of the rehab, you can cook the peas up.
And be on my diet still.
And you can still be on your diet, actually. Yeah.
Let me ask you, Mark's never pitched before, so he's basically has to learn how to pitch. Turk was talking about the slider as far as the pitch that can do damage to the arm. Are there any pitches, as far as learning how to pitch, what pitches should he stay way away from? Is there anything as far as the shoulder is concerned, as far as his health is concerned, you would recommend he not even try to learn?
I'm not a pitching coach,
right,
but from my standpoint of looking at kids, I try to treat everybody like kids. I tell the kids, don't stop throwing a curveball or changeup or a slider until you can shave. And that's usually the general rule we talk to kids about. We talk to different kids in high school. Don't do that. I think right now you don't need to be changing the mechanics of your arm, because a lot of people will throw the slider and they think they know how to throw it, and they're doing this and they're changing it. And I worked with a guy who actually was a pretty decent pitcher, Tom Glavine, for a couple of years, and he basically threw a fastball and a changeup, and it's just the grip was different. It didn't change anything in his arm, and this guy basically really didn't have any shoulder problems for his whole entire career, which is really pretty remarkable. Now I'm taking a guy who's a super talented guy, and using him as an example, which I don't like to, but he really didn't use a whole lot of other pitches. Basically, which is the fastball and changeup, but just the way you held it in your hand, and it wasn't a matter of changing things. I know guys who try to throw curveballs, slides, and start doing this kind of crazy stuff and getting out of their mechanics. And these guys will be able to give you a little bit more instruction about how to throw things, way more than I could.
And the difference between, obviously, you've been at the highest level, you're now with the minor league guy, and then you're here, these type things.
Sure.
Which is the most fun for you?
Oh, well, this is a lot of fun. You have a lot of fun here during the course of the day. It's sub-max. I enjoy teaching the younger trainers things to work with their guy. I think I enjoy that the most, is watching a guy look at somebody and how they're treating him, and the relationship with the players, and the relationship with me and the trainers, and teaching the trainers a couple little tricks, and try to just kind of look at things a little bit differently, and teaching the trainers more about their jobs and getting them better. That's probably the most fun that I have.
And one player that you think you've helped the most come back from an injury just by the way you treated him and the way he responded to your treatment?
We've had so many people down here, it's really hard to put a name on it. Jay Payton was here for a long time, and he had bounced back from 2 elbow surgery, came back. Paul Wilson was here for the longest time, got better. There's a whole bunch of other guys who have come through here and didn't really even get back to the big leagues, but came back to throw, and they're able to pick up their kids now, and they're healthy, and some of the things that I've tried to do over the years. I mean, there was so many minor league guys that I couldn't even mention that I've tried to help over the years. I still keep in good touch with and friends with, and they've been happy about it.
Well, I hope next year I don't see you at all.
Yeah, I hope so too.
That's the
All
goal.
right, of course. Good luck.
Thanks.
All right, take
See
care
you.
of yourself. Okay.
All right.
Glad you do it.